Welcome to our webinar on contacts, referrals and secure messaging for allied health professionals. This is webinar 2 in our series of 4 webinars brought to you by Allied Health Professions Australia, AHPA. I'm Katrina Otto. I've had my small business, Train IT Medical, for 11 years now, providing medical software training and practice management consultancy services. But I've actually been working in medical practices for 27 years, pretty much since the first medical software came in. So I've seen a lot of change. I work across disciplines across Australia, and my aim is to help with business and clinical improvements with efficient use of technology. So while you can see there I do train certain products and will refer to many, I don't sell any products. So I call myself Switzerland. I'm neutral. I like all technology. In webinar 1, we concentrated on medical software. That webinar was recorded, as they all will be, and all information will be available on both ahpa.com.au there or my website, trainitmedical.com.au. So we had over 400 health professionals in our first webinar from all 23 different allied health disciplines, which is just fantastic. And tonight we've got the same by the look of it. So it is just wonderful. I appreciate the time you're spending here tonight, and we really want to make it valuable for you. We've created resources for webinar 1, and we're still creating even more, specifically with the aim of helping you make what is often a really difficult and important decision regarding which software to use, and then how best to move forward. There is a list of software vendors and a software priority selection tool that we've put together, which is now on my website. It will be on AHPA's too. And I added the list of features matched to the software products today. And AHPA has made a commitment to keeping that updated, which is fabulous because technology is continually evolving. We are far from achieving every feature we might want in our software. It's often a matter of prioritizing the essentials. So the vendor list is available on our websites for download. I've also got 2 further pages of learning and links, and I encourage you to download that as well. So tonight we'll focus on those key features related to managing referrals. We'll share tips for improving communication with referrers, and I will demonstrate some letter writing features in medical software and encourage everyone to consider using secure messaging options. I listened to your feedback from the previous webinar, and your feedback said, you would prefer to see a few more visuals of what features actually look like in the different software products. So I have struggled with how do I fairly represent more than 30 different software products, but I have put a call out, and some very kindly and very enthusiastically engaged, sent a lot of information. You will see tonight that when I talk about secure messaging, you will see Core Plus has sent some extra information related to secure messaging. When I talk about communicating with patients as well, then you'll see MediRecords has an app and the ability to share some or all of the medical record. A lot of your feedback relates to the cloud and security, and Joel from Clinico has kindly offered to give us even more education in this regard as well. So we will include that for you all. We will include it in all the webinars that we're doing, and we've also put a call out to all the vendors to host their own specific webinar so you can really see each product. So hopefully that will help you with your software choice if you are still at that point of trying to say, well, which software will I move forward with? Tonight I want to look at those features related to referrals, with contacts and with secure messaging. When we look at key features related to managing referrals, it is a complicated world when it comes to health and technology because our patients' information is often sensitive and bound by principles of privacy, confidentiality and respect. But we're living in an era where patients want and expect access to their health information like never before. So I will talk about privacy principles a little bit tonight. I'll also be talking about standards. And I thought I would include a reference to the Royal Australian College of General Practice standards. As you may know, I train the two most commonly used general practice software products, the competitors, Best Practice Software and Medical Director. And I've been working in the health industry even before we had standards. I think these RACGP standards are good standards. They apply to most of our health practices. So I've just included those as well, and I've got links within this presentation. So if you're interested in reading more about rules, legislation, standards, and ideas from other sources, then the idea is that this will be a document that you can use for further learning. I also thought that it might be very helpful if I could show you what it looks like in software and what it looks like when a GP generates a referral to you from common GP product. Some of you have told me you actually use Best Practice or Medical Director, and if you work in a multidisciplinary clinic with GPs, you may. So this is a quick demo of the process of sending a referral from a GP perspective, sending to you. So I'm going to use Best Practice for this demonstration, and I've got a patient record open, Anastasia, and I'm just going to go to the letter icon up there and generate a letter. In this software on the left-hand side, I can save my favorite, my commonly used templates, and here I've got one which is a referral to physiotherapy, which is in this case going to refer to Life Care. Now, we have address books, contacts in all the software. It's an essential feature. It's pretty similar, as you will see, in a lot of the software, and we have categories. The idea is that I can see here that I can refer to Life Care. I can also see that they are users of HealthLink, which is a secure messaging product. This template has been set up, and I can write my own clinical notes on this. And I'm not going to do any more than that. That will just keep it very, very simple for this example. So the idea is I've generated a template. I don't have a phone in there, so I'm just going to edit that a little bit, and I have a referral. I can then print that, should I choose, and or send it electronically. So this is secure messaging, which I'm going to be talking about tonight. And to show you how easy it is, once set up, I click on that out box, I save my letter, and that has gone to the recipient. This is all a sample world, so acknowledging that, pretend world, but that is as easy as it is once it's set up. So the fact that I have created that is saved in my patient record. I can double click and I can access that again, edit that. I'll go out the door. In my clinical notes for the day, it has automatically documented that that's the action I have done. So that is how easy it should be to create a referral, access your contacts, and send electronically to another healthcare professional. It takes a little bit to get there, and that's what I'm going to talk about tonight. So those steps: generating the referral, accessing the contacts or the address book, completing the referral, that should say saving, really, that's what I mean by completing, and using secure messaging to send it. From a GP perspective, of course, it's saved into the patient record. That notation is automatically there, that action has been taken. Here is, I guess, just further evidence from a referral. That would be a referral that allied health professionals would be very used to seeing. That's the TCA referral from a GP to allied health professional, and of course it states on there that it must be kept, and that document refers to the fact that anything that we're sending either electronically or in paper needs to be kept in our patient records. So the idea of having medical software allows you to keep everything related to the patient within the one place. Just a few more tips here for referrals. And if you're sending referrals, I thought this reference again from the GP standards might be of interest to you. As I said, we're living in an era where it is vital we communicate clearly with our patients. So informed consent and protection of patient confidentiality with referrals, it's important to consider this. And I am reading this a little bit because a couple of you said you listened to the webinar while you were driving in your car. So I'm mindful of that tonight. I'm going to read my slides a little bit more. So inform your patients of the contents of the referral letter. Show it to them. As it says here, where appropriate, offer them an opportunity to read it, give them one, include them in the conversation. I find allied health professionals actually do this really well already, but just to show you that this is the expectation now in the standards. And when we get to webinar 4, and I'm talking about digital health and My Health Record, you will see that patients now see a summary of their health information, including referrals possibly at times. So programs like MediRecords, patients can share part or all of their medical record with the practitioner. And Best Practice Software has a new product they're hopefully releasing very soon called Best Health, which is an app that allows us to communicate with patients via that app. So it is a new era. Now, I have links there for more information about that information security and so on. And I also, because I've gone from general practice, I also went to in search of more referral essentials. And this is actually, I'm a big believer in don't reinvent the wheel. So have a look what's already out there. This is a really good guide from Fitness Australia, and it actually talks about those that advice on what makes a good referral. I just outline the essential checklist here. And note that number 5 is all about involve your client. Ensure they are informed, gain consent. Good advice, I say. I live by the mantra, if it's not documented, it didn't happen, because that's the world that I, am working in. So you do the work, the clinical care is always very good, but we also need to ensure that we're making it as easy as possible to keep documentation for everything that we're doing. So the software features I'd be wanting to help with referral efficiency, these are really important features. Generating them in reports or referrals and ensuring they're saved into the patient record. Being able to send and receive them using secure messaging. It costs $3.20 to send a letter when you take into account everything, the postage, the toner, the envelope, the time, and it's really, really inefficient, and it doesn't protect confidentiality at all. So secure messaging, while far from perfect, is a significant improvement from a business perspective as well as a patient confidentiality and care perspective. If you are receiving paper, scan any manually received referrals reports and manage that database of referrers. We need to be able to manage the data so we can do things like report on referral activity. Helps us better manage our business. Where are your referrals coming from? How many people only ever refer to you once and why? So tracking referrals, being able to see who did you send a referral to? Have you received any further information about your shared patient? Again, referring to general practice referrals, we have to track what's called clinically significant referrals, which is if there's a possibility of harm that may come to the patient. We need to see them, we need to track them, we need to show how we're following up. So if we look to your contacts, your address book or your contacts, it's all about, managing referrals. So we need to keep the contacts up to date, obviously, because it makes it easier to share electronically and we can reuse those details for letter writing. We also want to be able to use them for marketing, or as I call it, good preventive health management. I don't call it marketing usually. If we manage our contacts well, we can categorize for searching efficiency. So some of you I've been fascinated to see your allied health disciplines and how specialized some of you are within those disciplines. So we need to be able to find you. You have this fantastic point of specialty. We need to be able to see that and find you, and that's what managing your contacts is about. I've now got some screenshots. This is what the contacts look like in Clinico software, in Hippocamp, MediRecords, Power Diary, and Best Practice has a suite of tools. So BP Premier is the one often used in multidisciplinary clinics and general practice. BP Allied is their product specifically for allied health, and there's a new release of coming out, I believe, in the next few months. But I wanted to show you this also because where I've got the arrow there, it shows you how we enter which secure messaging provider this allied health professional, specialist, doctor, this health provider contact users. So that will make sense a little bit later, but that's how you enter it in Best Practice. And in Medical Director, you can see there we've got what's called a EDI, which is a unique identifier for secure messaging. Secure messaging is encrypted emailing. It's how we are allowed to email. We call it secure messaging. So with those referrals, we have the importance of tracking them. Now, this is purely taken from the websites of the software products. So you can see there they have features. It's really helpful to go to each product website and see what they do and then drill down and asking specific questions. So storing them, being able to report on them, you'll see there is a common theme. And this one turns red when it's the last appointment covered under the referral. So all different sorts of features to help with that. And I guess the last thing I would like to say about referrals is, well, what if you want more? So we talk about our medical software, but we also are fortunate enough in Australia to have a lot of third-party tools that add on to our practices that offer other benefits, hopefully, if you need them. So do you need more referrals? And here's just an example of one third-party tool that is designed to help patients find you and then refer to you. So I've just popped that in there because I thought if anybody's looking to grow their business, then that's the sort of thing that I would be suggesting that you have a look at. All of those third-party tools that allow patients to see you. Need to have an online presence, and we absolutely will Google you before we attend your practice. And I was communicating with I won't say any names, but one of you who's attending tonight, and I was commending her and saying how impressive her website, her email was, her logo, her website, and her Facebook page for the business. And all of these, just created this impression in me that it was a really innovative, progressive practice. Whether it's true or not, that's the image you want to create. So how do you improve communication with referrers? These are a few of my tips. So being able to have a relationship and thank them, we can only do that and see really easily and clearly if you have a data tracking source. So that's where your software, I guess, comes in. As I said a minute ago, showing that you're progressive, you're keeping up. I've often said, with GPs, that I personally wouldn't feel that they were keeping up with modern medicine and therapies possibly if they weren't using a computer these days. So that's the impression of your business. Being able to simplify report writing and creating your own referral templates is another idea, and I'll talk a little bit about that because that's what you saw me do when I did a demo using the GP software. The physiotherapy practice had created templates that worked with best practice and medical director and ZMed, I believe, and then gave them to the GPs who refer to them regularly. That was a way of driving potential business to their practice, being visible and making it easy. GPs, like you all, are time poor, so making it easy for them, that's the goal. So using secure messaging to send and receive, while it is not easy to set up, I will acknowledge, I feel for a lot of you, you don't have a lot of admin support to help you with that. It's worth it. And using secure messaging will benefit the people who refer to you. For GPs, it's part of their accreditation that they use it. So if they're an accredited practice, they would have it and they need to use it. So they may not know how to use it, and that's like all of us. Just because we have software doesn't mean we know how it works and how to use it well. So this is something that we will see a lot more of as we start to improve the coordination of care for our patients and work much more in a, I guess, a multidisciplinary team-based approach for our patients. Now, when we're communicating, of course, we can't not talk about the concept of actually writing those letters. And I've just got a few points here to make about the software, the letter writing options. These would be what I would be looking for if you are looking at the features in the software, and being able to create your own templates. That's not something that every software does, and that would be pretty important to a lot of you, I would imagine. When you create those templates, database fields merge with your client-specific details. So it will pull in automatically that patient's name, date of birth, and clinical details too. We also want to ensure that you can save them, you can edit them, you can have them in draft. Some even have features like voice to text, and being able to create forms. I usually say in any practice, any piece of paper that you have lying around is either a template or it's a handout, and put it in the computer. So a paperless office. And while we may have paper all over the place during the day, by the end of the day, there shouldn't be. So if it's a form that has patient details needing to be on it, then it's a template with your letters. If it's a handout, maybe it's a diet or an exercise program, well, that gets scanned into the software and generated as part of the patient education features. So you should also be able to have your own letterhead and or one for the entire practice. So these are just ideas of what I would suggest looking for if you're looking for the letter writer feature within your software. And again, giving you visuals of what it looks like in different software programs. There is Clinico, and we've got MediRecords, and we've also got varying features in all the software. We've also got varying connectivity with secure messaging. So I take a deep breath when I talk about secure messaging. And the reason for that is, and as you heard, I am a fan. I do believe we should all move forward with it, but I get frustrated because, even this blog I wrote 2 years ago, nothing has changed. It is still 4 steps to the secure messaging success. I put it there because it's still the steps you need to go through to get it to work. And I would hope in 2 years that it was easier, for you all. The idea that we're going to have one directory, you'll look up a health practitioner and you'll hit send and it will get to the other end securely is, what we all want, what we're all working towards. But I was working in a country town on a project a couple of years ago, and I found all the practices were receiving via secure messaging. there was 13 practices, I believe, and they were all receiving via secure messaging, because remember, in general practice, results, pathology, radiology is received via secure messaging and has been for, must be more than 10 years now. And all these practices were general practices. The town did not have allied health professionals who lived there. So at that point, and there was a lot of sending back to the bigger city of information. When I questioned, so all of them were receiving, but only one was sending via secure messaging. And when I questioned that practice, they raved about it. They said it saved them 50% of their scanning. That saved them one admin person per day time. Now that's money. If you're running a practice, if you're spending time scanning, that's a waste of money. It's also a privacy risk. So when we're emailing, they must be encrypted. We're not allowed to use standard email. It's got to comply with privacy, our Australian privacy principles. But when I asked that practice, why are you receiving your results electronically? When I asked all the practices, why are you receiving them but you're not sending them? Whereas the one was, they all said they just didn't know how to use it, or they hadn't taken the time. So that's why I wrote the blog. That's the feedback I get of how it does protect confidentiality and save time is why I believe we need to keep using and building our connectivity with each other. So why it's difficult is, you know, for allied health, we're focusing on these top two. Why it's difficult is if you send a referral using secure messaging, which is your encrypted emailing, the recipient needs to have the same encryption that you do so that they can decrypt it at their end. So that's the reason why it's challenging. And the bad news is that you have to have that. You have to have the same secure messaging provider to send and receive. The good news is there's not 100 of them. There's not even 50 of them. There's not even 15. So I'll show you how you connect. But I just wanted to also mention that from an allied health perspective, you're focusing on sending and receiving reports and referrals via secure messaging. In general practice, they can send and receive all of these things. And I just wanted to let you know that in webinar 4, I'll be talking about digital health, My Health Record, and that My Health Record in itself means that you as allied health professionals can access your patient's results and discharge summaries from the My Health Record also, if that's appropriate to your patient consultation. So this is significantly progressive as far as your ability to receive confidential information about your patient. So it is a step forward. But when we're sending and receiving documents, as you saw, you create and send them from LetterWriter, and you receive them also straight into your clinical software. Now, some of you listening don't have clinical software, and I know that, and I just wanted to let you know that with secure messaging, there is a Word plugin for a lot of them, and that physio referral that I created those templates for the physios. They didn't have software at that time, and that was a couple of years ago, and they had a Word plugin to enable them to receive those referrals. So it's step by step, but the goal is that you have that information. You also have an audit trail. So when we're sending via secure messaging, one of the specifications is that we can see if it's been delivered. And you don't get that in with Australia Post. Next webinar, we'll be talking about how you can quickly include your clinical notes into referrals and reports too. But, you know, from a benefit perspective, I've talked about the confidentiality. I can't tell you how many times I've worked in a practice and picked up a document and gone, oh, what'll I call it? Who is it for? Oh, I know that person. So we're not doing everything we can to protect privacy when we have the ability to use secure messaging. And even from a practice perspective where people are still, they're using secure messaging, they're still receiving some paper in the practice, they can do things like fax to file, keeping those imported documents in the patient record. So this is all, wherever you are on the spectrum of improvements, there's always a next step to take. So a read receipt. Now, I told you I would include the privacy legislation in here as well as ensuring that it is secure, encrypted, it doesn't go outside Australia, and I've put a link to the principles here. You need to be able to easily access it again. So that's the whole concept of the medical software, the patient record within that. The recipient must consent to receiving information electronically. They must be certainly consenting to everything that we're doing these days, and we need to have process around that. And also, I would say if you're sending using general email, you need to make patients aware of the risk, and there needs to be specific documented consent, because that is not an acceptable standard. So there is more information about the legislation if you are wanting to read a little bit more about that. And Core Plus has also provided a bit of a snapshot of why, the risk of interception. It even happens, I find, with faxes, that whole current practice of faxing from health practices, and I've had this year alone confidential patient information turn up at a smash repairer and a hairdresser. So it's too much user error in that. So it is also, I like this one, if you're not connected, they can't see you. So do you want to have a successful progressive practice and be seen as such? Yeah, it's like working smarter, not harder. So here's a list too from Core Plus of the pros and cons, and I added this one. So the idea is a lot of the feedback has also been about communicating with patients. So this secure messaging is not designed to send information to your patients, and that's why I've now included that as a part of our next webinar as well, because I hear that that's something that's important to you all as well. So look at secure messaging with your software products would be my advice. When it comes to how do you send securely, as I said, secure messaging really means encrypted emailing, and we have to send and receive, and they need to be able to decrypt it. So it has always been, if you're using Argus, the recipient needs Argus. If you're using HealthLink, the recipient uses HealthLink. This is a picture from Telstra Health Connect, which is Argus, and I think it's a good picture because it just shows you, and I believe that the secure messaging providers call themselves like a mail person, a mailman, a mail person. They don't open it, they just securely deliver it. So it is, whether it's results coming in, whether it's a hospital discharge summary, whether it's allied health and specialist reports, or general practice. That's the way we communicate. And I also wanted to refer to this section over here about the health provider directory and the National Health Service Directory, because I'll just be putting a slide at the end which is sort of encourages you all to add yourself as health professionals to these directories so that other people can see you and are able to send. So this will be very much working towards that goal, as I said, that we won't have to know, does that health practitioner use Argus or HealthLink or Medical Objects? What do they use? We won't even have to know. We'll have a directory and we'll be able to send. But at this point in time, we still do. We have to find out, who do our referrers refer to? So there's the RACGP rule there. It must be encrypted. If you aren't using encrypted emailing, you must have informed consent, and I know the indemnifiers would say you must make them aware of the risks. So let's have a look at what choices we have in Australia. These are the standards that, standard secure messaging providers that we're using. So Argus HealthLink Medical Objects, MMEX, ReferralNet. There are more around all the time. I encourage you to have a look. I've put their websites there, and it is pretty much, area based. So depending on what area you're from, so I always know when I go to Queensland, most people will be using medical objects. I live in Sydney, and here we use a combination of Argus and HealthLink. Western Australia commonly uses MMEX. So it's just about finding out, and to help with finding out, we have usually portals, web portals where you can go and have a look. So the idea is, who refers to you, have a look, ask them, or have a look. Sometimes on their referrals they may mention it, and they may talk about what's called an EDI, which you add into your software. So it is about finding out what they use, connecting with that provider, adding that into your software. And this is what I was referring to when I showed you the picture of best practice and medical director contacts, where I said we would add those EDIs into the software, and that's what enables us to then send, just like a normal email, with one click. So there is a plugin for Microsoft Word, as I said, so you can still send and receive if you don't have clinical software, or if the one you have at the moment doesn't integrate. But, your software vendors, they're listening tonight, they're listening to you, they want your business. Please tell them what you would like. It's the way we get better products. I had a look at Argus, which is Health Connect's Argus, and they list on their website the products that integrate with them, and some of them only receive, some of them send only, and as you can see from this list, there's a list of the ones who send and receive. So we want to be able to, moving forward, we want to be able to send and receive, and once you do send and receive, you'll need to be able to see that. So that says a picture from Core Plus, what it looks like in the secure messaging inbox, and there's a picture from MediRecords of what it looks like. So we do need to be able to track that, and hopefully gone will be the days of I lost my referral, because you have it electronically. Now, the last thing I wanted to cover relates to registering to ensure that you're on directories. Because as I said, the secure messaging, it's far from perfect. In my ideal world, we do have one directory for all providers, can look them up, hit send. This is the plan. So what you can do right now to help with our national plan is to register with the Health Identifier Service. Now, I will be covering digital health in detail in webinar 4. You'll be a step ahead if you have already registered by then. You all have unique identifiers because you are health professionals. If you're registered with your association, AHPA, you need to register with the Healthcare Identifier Service, and then there's a link there to do that. I would also suggest you access the National Health Provider Directory and add yourself to the National Health Services Directory. So this one's a joint initiative delivered by Health Direct, so it enables both health professionals and consumers the ability to access information about health services. So there's an app, and the idea of this is you will be able to register your health service. You can see it right there on the screen, and you really need to be on these directories so you can be found. Whether it's eHealth, the NDIS, or secure messaging, if you're not online, they won't find you, and that's got to be bad for referrals. So thank you, everyone. I hope this information on referrals, contacts and secure messaging was helpful tonight. Please note I have not one but 2 pages of learning and links. Depending on what information you are interested in, what your next steps are, I have that information for you. We also will be hosting the next webinar, as I said, on clinical note-taking, but I'm also going to include in that more information related to communicating with patients and aspects related to security and responding to your questions. We'll be posting, this recording will be up by the end of tomorrow. The slides are already on my website, and we'll also be putting those on AHPA.com. .au. So our next webinar will be there for you to register, and I would encourage you to keep talking with us. Tell us, you know, what you need, what is helpful to you, and the idea of wherever you are on that spectrum of technology use. The next step, hopefully, is a small but important and helpfully beneficial step for your practice. So thank you very much, everyone, for joining me, and I look forward to meeting with you again in the next webinar and talking with you in the meantime. Thank you.